I'm Dean Cattleman. I'm from Brookings, South Dakota. I'm retired now. I enjoy hunting and fishing, playing quite a bit of golf. I was working in the shop, and I was driving in screws with a power drill, and I hit my hand and I took my middle finger off. It was detached at the knuckle. It was only held together by the tendons. I called the emergency room, and I said, I've lost my finger, and their question was, do you have it with you? And I said, yes, it's barely attached. I was met at the door immediately. She dropped me off at the door to go park the car, and they escorted me back into the emergency room. And at the meantime, they'd already called in an orthopedic surgeon. And so I got into the emergency room. They said, do you feel anything? I said, what do you mean? Because they were pinching on my finger, and my finger had tourniqueted. The finger had turned completely around, so it pinched the nerve and the blood to the fingertip. I was resolved to the fact that I was going to lose my finger, and so I went in and I had a really great meetings with the emergency nurse staff. They welcomed me. They tried to relieve any pain. They explained to me what was probably going to happen, and so it was a very good experience. I was really impressed with how they took me in. There were some people waiting to get in there, but they immediately took me in ahead of a few other people as they determined it was an emergency. Once they got in there and repositioned the finger, popped it back into place to amputate it, they noticed that the fingernail was getting a little bit of blood to it. And so they called my wife and said, we'd like to see if we can save the finger. It won't be any different tomorrow than it is today, but we'd like to see if we could save the finger. And of course she said, yes, please do. And I was unaware of any of this, of course. And so they repositioned it, reattached it, braced it, and said, come back tomorrow morning. And of course my hand was all bandaged up and everything. They said, we think we might be able to save your finger. We'll know in 12 hours. I came back into the into the emergency room, saw the orthopedic surgeon. He looked at it, took off the bandages, and said, yeah, I think we might be okay. They just kind of explained to her what the procedures were, made sure that she understood, that I may not have fully understood, but they made sure that we knew what was going to happen and the procedures that they were going to do and the process. Oh, my recovery was very good. I mean, they gave me some pain medicine, which I took a little bit. They gave me some swelling medicine for the finger, and then they just basically put me on therapy. And about 3 weeks later, I had a little bit of movement in the finger. They'd put a brace on to pull the tensions down and stretch it. And then they did it it took about 6 weeks, and I had about 90% recovery. And it took about probably 12 weeks. I had 100% recovery. So I'm lucky finger's working fine now. It's very important to have local facilities available, and we're lucky to have a surgeon that was on call that could come in to help take care of the procedures. I'm not sure if you know, we live further out, 30 minutes, but definitely made a difference. I probably wouldn't have the finger. I think that they provided us a warm feeling. They made you feel comfortable. They didn't panic. They just went through the motions and really made a relaxed atmosphere. I think that they need to know that it's here, that they are caring, and they have the quality people. They have professionals, well-trained professionals. It's not as it was 25 years ago when we came to town. It's a young, very up-to-date, very professional organization.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.